Hi, everyone. I'm Frank Mallicoat. I'm an anchor reporter at Fox here in the San Francisco Bay Area. And my guest is the chief of research at GoodRx to talk about keeping healthcare costs affordable, rather, especially with over 17 million plus Americans right now with losing their jobs, unemployed. Let's say hi to Mr. Thomas Goetz. Thomas, how are you?
Very well, thank you.
Good to have you with us. Talk about GoodRx out of the gate. Tell us what your company does.
Sure. So GoodRx is a consumer website, and we have some mobile apps that basically help people find affordable healthcare. So we have discounts for prescription medications, and we also offer telemedicine services and marketplace for telemedicine, so people can access care through a doctor.
My guess is you folks are busy. 17 million plus Americans out of a job right now, presumably without healthcare or looking for healthcare. What's it been like?
Yeah, well, so struggling with healthcare costs is a perennial issue, but it's definitely a more acute problem these days. And hopefully, people are able to find us and other resources to help get them, the resources and care that they need.
Yeah. So say you're a family of four, you got a couple of kids, the father or the mother lose their job, they're the breadwinner. By losing their job, they lose their healthcare. And we need it, especially with a pandemic going on right now. What's the first step they should take towards getting insurance?
Yeah. So the first thing to do is see whether they can get coverage through either COBRA or one of the, if they're in a state that has an exchange that is opened up for enrollment. So in California, they've actually opened up the rolls again, so you can actually get coverage through the Affordable Care Act. Now you're still going to have to pay for that, and that can be expensive. But if you're low income, you might qualify for Medicaid. That's also something to check out to see if Medicaid will actually for more cost.
Yeah, I have a friend that's in her 50s, female, single, doesn't make a lot of money, $900 a month here in Cover, California. It's expensive.
Yeah, and that's where, depending on the plan that you sign up for, you could have a very high deductible. It could be ways to lower your monthly spend on that, but you're going to be exposed then to, as I say, more of the deductible or more of the day-to-day costs for routine things like medications if you're taking medications for a chronic condition.
Talk about telehealth and what that's all about.
Sure. Well, this is something that has changed dramatically over the last month. A lot of people are not going to the doctor, but they still have needs to see a practitioner. So telemedicine, telehealth is exploding. We have a service on GoodRx that helps people find, for hundreds of conditions, there's various providers through telemedicine where you can see a doctor either through a chat or maybe a video connection, and get access to the care. They can answer questions, but they can also prescribe for you.
Yeah, and do you think that's the wave of the future? Because I spoke with a doctor over in Sausalito who said there's like layers of triage right now where you meet with one doctor, but especially with the coronavirus. But she says that I think we're going to do a lot more of this in years to come. You agree?
Yeah, it's funny. It's been available for many years, but people weren't really using telehealth very much. But I think now that it's become ubiquitous, you're definitely going to find people finding it more convenient to get a few questions answered from their homes rather than having to go to the clinic or office.
Yeah, more convenient too. Buying in bulk, if you've got a prescription that gets renewed monthly or every other month, is it cheaper to, say, buy a 3 or 4 month supply out of the gate?
Yeah, it often can be. So if you are used to filling at every 30-day, if you ask for a 90-day fill, that can actually reduce your costs dramatically. So it's definitely worth asking your doctor or your pharmacist to see if you're available or see if you're able to get a 90-day fill instead of a 30-day fill.
Right. Community care and hospital charity care programs.
Yep.
Another way to save money and get medical care. Fill us in on that.
Yes. So there are some amazing physicians and healthcare practitioners at free clinics in our community in the Bay Area. And they're, as I say, they're superb doctors, and people should not feel bad about using those resources. They are there for the community, and especially now in a time of need. Those are resources that really they're there to help people. So definitely find a free clinic near you.
And how do you find it? Do you Google it?
So there's a group called the National Association of Free Clinics. So you can look there, or you can just Google free clinic near me, and you'll have a map of those depending on where you live.
Yeah, it's a brave new world. No more yellow pages. How about coupons? I know that your company offers those for prescriptions for what?
Yeah, so we offer coupons for discounts on medications. So this is even if you have insurance, you might be able to find a coupon or a discounted medication at your normal pharmacy, but it could be very well cheaper than your insurance. So we're able sometimes to beat insurance prices by $20, $30 per prescription. So especially when people are going to be being very careful about their savings, it's worth making sure that you check to see if there's a discount available for your prescription instead of just paying for your insurance price automatically.
Absolutely. Hospitals are mighty busy right now getting ready. I know here in California, it's not as bad as New York and some of the other hotspots, but some people are ill with other maladies and they need to see a doctor or get help. How do they do that? Are they being pushed aside, or how are they setting up who gets in and who does not?
Yeah, so it's actually in California, hospitals are actually fairly empty now, which is probably good in case there is a need from coronavirus. But you're still able to get in contact with the clinics or the specialty service that you might need by phone, and then they may arrange a visit via Zoom or via telephone or via email, where the doctor, if you have a regular doctor you would use, they're probably using something like that, and you can still get in touch with them. So don't feel like your doctor is unavailable to you now. And if you do want to use telemedicine, as I say, it's very easy to find another doctor to do a quick evaluation. Through GoodRx, we do free screenings online for COVID and other conditions. So if that's something you want to get, go online and look for a telehealth provider that has a price. For us, we charge $20. So it shouldn't really be an obstacle to getting care.
So for $20, you can actually talk to a doctor or at least get information.
Yeah. So for most of our conditions, it costs $20 to get an evaluation. And if that results in a prescription, that's part of the prescription is extra. We do free screening for COVID. So you can, if you feel like you might be exposed to the virus, you can consult with a doctor and get assurance either that you don't have it, or they may recommend that if your symptoms are severe, may recommend that you do go to an emergency room.
Do you think healthcare and insurance is forever changed because of the pandemic?
Yes, I do. And I feel like there are a few things that probably are going to change. One is how we access primary care. That's definitely going to change. As you said, with telemedicine probably absorbing a lot of the first layer of services and inquiries. I think we also are going to find, they're doing things like they're finding that infections outside of COVID are way down because people are washing their hands more. So
good point.
So just the needs that we have are probably going to change as we're learning a lot of new habits, I think, that are going to change our healthcare needs.
Well, along those lines, I think the way we greet people, the way we congregate, the handshakes, hugs, all that kind of thing, maybe that's why we're all getting sick. Who knows? But you're right. It doesn't seem like we're hearing crime has gone down. A lot of things, pollution has gone down when we just
and we're
get to the basics,
more.
I guess.
Yeah, and people are going for more walks. They're cooking more. They're baking cookies. I make banana bread every day,
There
So
you
some
go.
of these are good changes, and
I agree.
hopefully we won't lose sight of these changes.
I know one thing I'm doing, I'm trying to call an old friend or an acquaintance I haven't talked to in a long time, just hey, how you doing? What's going on? Hope you're safe, that kind of thing. It's opened up some new doors. So um, in all the ugliness that is the coronavirus, there is some good things that are kind of blossoming, so to speak.
Yeah. No, and I'm following on Twitter. I'm following hashtags like life after COVID and silver linings. There's a lot of inspiration out there, and there are a lot of people who are looking to the future and seeing, when it does come time to open up and to start to rebuild, we want to be sure we are rebuilding for health and making sure that we emphasize sustainable health for everyone.
Yeah, I think I've washed my hands 1,000 times in the last couple of weeks. So, and I can't imagine shopping without a mask. I hope we can lose that eventually, but I think we're heading, hopefully, in a safer and healthier direction.
Yeah, and I think we have a head start in California. So I think knock on wood, we'll come out of this in pretty good shape.
Have you noticed that too? You're in San Francisco as well as I. I know other states were kind of slow to have people shelter in place. New York, obviously, behind the eight ball in a big way. But it seems like most California and San Francisco is a ghost town. I do walks at night as well, and there's, you keep your distance, but there's not a lot of people around.
Yeah, no, I can see 101 from my house, and it's like Sunday at 5 a.m. The amount of cars on there. So people are taking it seriously. I've been very impressed. We at GoodRx, we ran a big survey of whether people understand the stay-at-home order and what kind of behaviors they're doing. Mm-hmm. And California has some of the best adoption of stay-at-home behavior in the country. So we're definitely doing things right.
Well, good for us. A pat on the back. Anything else, Thomas, you'd like to add?
No, I think that's about it.
Okay. Well, he's the chief of research at GoodRx. That's Thomas Goetz. Thomas, thanks so much for sharing some insights, and stay healthy, my friend.
As well. Have a good day.
All right. I'm Frank Mallicoat. We'll send it back to you.